CoolSculpting is not a replacement for weight loss. You know, I have a lot of clients that come in and they do either liposuction or CoolSculpt, and they really aren't changing their diet habits or any lifestyle changes like going to the gym. And I tell people, this is not a weight loss technique. It is to really sort of reshape your body and make you feel better in clothes. But if you don't change your habits, it's probably not going to be successful, because people that don't change their habits will continue to gain a little bit of weight. So if you want your optimum result, what I recommend to people is lose 5 pounds over the next 6 months after you've had the treatment. People always want to know if they're going to have loose, saggy skin after they have the treatment with either CoolSculpt or liposuction. And typically you are going to have retraction after you eliminate some of that fat. The people that are not are going to be people that have shot their elasticity. And there's 2 ways you can do this. Either by losing an extraordinary amount of weight. So if you're very obese and you lose the weight, you've lost some of your elasticity. The second way that you can lose your elasticity is if you've had a baby. And the way you tell if you're going to be one of those people that's not going to have retraction is if you have a lot of stretch marks. So if you've had a child and you don't have a lot of stretch marks, then you're going to have some retraction. And it's amazing how much retraction you actually do get. CoolSculpting is typically not that painful. Now, I've had the treatment done multiple times, and I have to say I'm a big baby. I don't like pain whatsoever, but with this treatment, I honestly did not feel any pain that's really remarkable whatsoever. When you're doing the treatment, it's a suction and a freezing, which starts to feel like a burning sensation, but after you've had the device attached for a couple minutes, the pain starts to dissipate because it numbs the area as well. And then sometimes the massage is a little bit tender, but I'd say not excruciating, and the new technique is not to do as aggressive of a massage, so that doesn't even feel that bad. Now, there is this situation in a very small percentage of people where they get pain after they've had the treatment. This is extremely rare, and I've never seen anybody who's had this painful situation after the treatment that lasts for more than a couple weeks. So in the majority of people, this is really not a painful procedure, and that's one of the reasons that this treatment is so successful is because there's so little pain associated with it. When we do CoolSculpting, you eliminate 20 to 25% of your fat cells. And so typically we recommend that people get 2 treatments in order to see their maximum result. You may see some improvement, but if you go in with the expectation that you're going to be perfect with 1 treatment, you're probably going to be disappointed. So we really encourage buying 2 cycles per area. Remove fat in one area does not go to another area. We're born with a certain number of fat cells. They're distributed unevenly throughout our body. So there are certain areas where you're going to have more fat cells. And that's what treatments like CoolSculpting and liposuction are for, is to even out the amount of fat cells you have in the areas where you have excessive fat. So once you eliminate those areas, or once you get rid of those excess fat cells, the fat cells don't go somewhere else. So when you gain weight, you're just going to gain weight in a more even way than if you had not had the CoolSculpting done.